wabarakatuh. Hello everyone, my name Tiara Firda Cahyarani, my number 73. I will to explain you about how to prevent coronavirus. Since early 2020, the world has been in a war by new coronavirus that attack human breathing and can cause death. The virus originating from Wuhan, China, quickly spread to various parts of the world. In Indonesia, the government announced that first case of the coronavirus in early March. Until now, the number of patients infected with COVID-19 is 10,000 people for 400 days and 400 recovered. What is the coronavirus? Coronavirus is a family of viruses that cause mild to moderate upper respiratory infection. The coronavirus was originally from animals such as camels, poultry to bats. Actually, this virus has rarely evolved in humans and only occurs in animals, but it turned out in Wuhan this virus proven to get to humans. What is the cause of coronavirus? Coronavirus infection or COVID-19 is caused by coronavirus, which is a group of viruses that infect by respiratory system. In most cases, coronavirus only cause mild to moderate respiratory infections such as flu. However, this virus can also cause severe respiratory infections such as pneumonia, Middle East Respiratory Syndrome or MERS, and severe acute respiratory syndrome or SARS. It is suspected that the coronavirus was initially transmitted from animal to human. However, it was later discovered that the coronavirus was also transmitted from human to human. A person get COVID-19 through a variety of ways, namely accidentally inhaling saliva sprays that come out when people with COVID-19 cough or sneeze. Hold the mouth or nose without washing hands first after touching an object affected by saliva samples of a COVID-19. Close contact with sufferers of COVID-19. Coronavirus can infect anyone, but the effect will be more dangerous or even dangerous if occurs in elderly people, pregnant women, people who have certain disease, smokes, or people whose immune system are weak. For example, in cancer patients. Because it is easily transmitted, the coronavirus is also high-risk infection medical staff treating a patient with COVID-19. Therefore, medical personnel and people who have contact with COVID-19 patients need to use personal protective equipment. What are the symptoms of the coronavirus? Early symptoms of coronavirus infection or COVID-19 can mimic flu symptoms, namely fever, runny nose, dry cough, and headache. After that, the symptoms can disappear and heal or even aggravate. Patients with severe symptoms can experience high fever, cough with phlegm, and even bleeding, shortness of breath, and chest pain. The symptoms appear when the body reacts against the coronavirus. In general, there are three general symptoms that can indicate someone is infected by coronavirus. Number one, fever. The temperature body above 38 degrees Celsius. Number two is dry cough, and number three, hard to breathe. There are several other symptoms that can also appear of coronavirus infection, although more rarely, namely diarrhea, headache, conjunctivitis, loss of ability to taste or smell, rashes of the skin. The symptoms of COVID-19 generally appear within 2 days to 2 weeks after the patient exposed to the coronavirus. Then, how to prevent coronavirus? Until now, there is no vaccine to prevent coronavirus infection or COVID-19. Therefore, the best prevention method is to avoid the factor that can cause you to be infected coronavirus. Number one, apply physical distancing, which is to maintain a minimum distance of 1 meter from other people and not to go outside the house unless there is an urgent moment. Number two, use a mask when on the move in public and when you go out the house. Number three, routinely wash your hand with water and soap or hand sanitizer, especially after doing activities outside from home. Number four, do not touch your eyes, your mouth, and your nose before you wash your hand. Number five, increase endurance with a healthy lifestyle, such as eating nutritious food, exercising regularly, getting enough rest, and preventing stress. Number six, avoid contact with people with COVID-19. People who are suspect of being positively infected by the coronavirus, or people who are sick with fever, cough, or runny nose. Number seven, cover your mouth and your nose with tissue when you cough or sneeze. Number eight, keep clean objects. They are often touched and environmental cleanliness, including cleaning the house. For people suspected of being affected COVID-19 or including in the monitoring person or patient under surveillance category, there are steps that can be taken so that the coronavirus is not transmitted to others. Number one, do independent isolation by staying apart from others for a while. Number two, do not leave the house except for treatment. Number three, if you want to go to hospital when the symptoms get worse, you should first contact the hospital to pick up. Number four, forbid others to visit you until you are completely healed. Number five, as much as possible, do not have meeting with people who are sick. Number six, avoid sharing the use currently and drinking equipment, toilets, and sleeping equipment with others. Number seven, wear a mask and gloves when in public place or with someone else. Number eight, use tissue to cover your mouth and nose when coughing or sneezing. Then immediately throw the tissue in the trash.